Hello, I'm Tim Dudderidge. I'm a consultant urologist at the Focal Therapy Clinic, and I've spent over 20 years treating men with prostate cancer. In this video, I'd like to talk through some important considerations around the diagnosis and treatment of prostate cancer. Men who have radiotherapy sometimes get a PSA rise, whether that's 3 consecutive rises or what we call the nadir, the lowest value, +2. If you find yourself in that situation, it's important to work out whether you need salvage treatment. Salvage treatment could come in the form of a focal therapy, which is probably the most acceptable, and that's with HIFU or focal ablation with cryotherapy or NanoKnife. And there's also options of salvage surgery, though the side effects of that are considerably greater and may not be that advantageous compared to a focal ablation. When you first get diagnosed with a rising PSA after you've had radiotherapy, you should see a clinician to talk about the possibility of being worked up for salvage. And by that we mean having diagnostic tests that first of all show us where the suspected recurrence is, diagnose it formally with histopathology, that's a biopsy test. And also we need a staging scan to make sure the disease hasn't spread elsewhere. And nowadays we use a PSMA PET CT scan for that purpose. We tend to get all of these tests organised quite promptly, and if we diagnose a local recurrence, that means that there's no sign of metastases, then we can start talking about the salvage treatment options. Most of the time when I talk about surgery after radiotherapy, men quite quickly realise that the side effects of this are not things that they'd want to go through. And in any case, if you have focal salvage treatment with an ablative modality, if that doesn't work out, you can sometimes still have surgery afterwards. When we're considering the different salvage treatments, we have to look at the location of the disease, we have to look at the neighbouring structures, and we have to work out how we can destroy that cancer with a margin to make sure we get all the cells, but avoid damaging important structures. The important structures are the urethral sphincter, the rectum, and the structures near the bladder as well. Normally we can deliver a treatment with HIFU or cryotherapy, and we can use fluids or spacer gels to move the rectum out of the way if we need to. And we can normally find a strategy that gets rid of the disease, even if it means ablating the whole prostate. The risks of this type of ablation are low, but they're still a bit higher than they would be if you hadn't had radiotherapy in the past. Once you've had the ablation treatment, it's normally a day case, so you go home the same day with a catheter, which normally stays for a week. And afterwards, urination is normally resumed quite successfully, but there can be problems of incontinence sometimes, but not anywhere near as high as after surgery. And you can sometimes get problems with obstructed urination, which we normally can manage with temporary catheterization or in and out catheters, we call them. Overall, the success of this treatment is very good, and we have to keep monitoring you because sometimes metastatic deposits can still come to light, even though the scans were normal at first. And very often these metastatic lesions, if they do crop up, can be treated with radiotherapy. There are good prospects for people with rising PSA after radiotherapy, and it's important that you get looked at quite promptly rather than things being monitored and left to sort of fester, because the opportunities for salvage treatment decline if you leave the PSA to rise too long. So if you have a rising PSA, come and get some advice. If you've recently been diagnosed with prostate cancer or you're exploring your treatment options, we're here to help. At the Focal Therapy Clinic, we'll talk you through your diagnosis, explain whether focal therapy may be suitable for you, and help you to make an informed decision about your treatment. You can learn more or arrange a consultation by visiting the Focal Therapy Clinic.